Congress turn to start going that way, sell that to me, a moderate dude in Minnesota, known in most states as, I won't say that.
Well,
camera rolling isn't there yet.
Well, the program that is offered, if it's a government program, it doesn't work. It can't work because the only way you can pay for it is somebody has to be shorted on care. And it's typically going to be those people that are no longer working in society, whether it be seniors that are in retirement or it's the disabled community. Those are the ones that are typically going to be suffering. That's not what this country's based on. By the way, I told you I offered a bill 2008 and offered it again this year called the Healthcare Freedom of Choice Act. And what that bill does, it works at both a federal level and a state level, and I hope you all help us get a hearing from the majority parties in both the House and the Senate, because it needs a hearing and it needs to go on the ballot next year. It proposes for an amendment to the Minnesota State Constitution two things, two elements. One, that the government can never take away our right to choose our own health care, and two, it can never deny us the right to pay for our own health care like they've taken away up in Canada. Why is it important at a federal and a state level? Because Obamacare is just the tip of the iceberg. We have a senator by the name of John Marty in this state who wants to run for governor, I understand, who's proposed his own Obamacare. He's got 70 co-authors in the Senate, and he said publicly that his goal is to eliminate, not restrict, eliminate all private health insurance companies in the state of Minnesota. We can take care of this at home. We can fix the problem. It's one of cost. The quality, nobody will deny. We have the best in the world. That's why Saudi sheiks come in here. And access is there. It's cost. And we can do that here at home.
Leslie, how do you sell the idea when they're high-fiving in Washington, D.C., you call a press conference, Governor Davis not taking the money?
You know, a lot of times you're in the middle of something and a new issue comes along. It's going to be Obamacare this time, and a few months ago it was global warming, and now it's Brett Favre and the Vikings, you know, and you're bobbing back and forth. But I'd have to confess that I really don't understand the healthcare matter as efficiently as I should, because I'm taken care of by the military. So I haven't had to shop around and deal with that. So I confess I'm coming up a little short, but it's amazing to me what I've learned, that you can't buy healthcare from anybody that you choose to, anywhere in the country, that you have to be restricted to certain companies. And so I'm coming of age a little bit in this healthcare debate. But one thing that I do know, that if it's offered by the federal government, it's not going to be the best thing for us.
Bill?
Again, strings attached. Why? This is a question you got to ask yourself. We go with Obamacare. Why do you want your care to go backwards? Do you know that Minnesota is in the forefront of the nation in providing health care for their people? In 1976, we passed a law for the Minnesota Comprehensive Health Association to provide health insurance to people who were uninsurable. First in the nation to do that. 1992, we passed Minnesota Care for the people who couldn't afford it, who were low income, in a subsidized premium. We all pay 2% when we go to the doctor. Okay? But you know what the problem is? They don't want to pay the $4 a month it costs to buy Minnesota Care and have coverage. If they just cut out one pack of cigarettes a month, they could pay for their premium. But we are farther ahead. We don't want to go backwards. We have some tweaking to do around the edges, and I'll admit to that. But just leave us alone. Let us provide care. Why do 70% of the beds up in Duluth hospitals, why are they Canadians? Ask yourself that. Why? We don't want that system.
David, your governor, headline in the paper, life is good. If you can't afford the insurance, it's here for you. You'll get the same insurance everybody else is getting. Governor Hann says, no, you won't, because we're not taking it. How do you sell that?
I think to me, it's pretty simple. We have in Minnesota, as Bill pointed out, we are one of the leaders in the country. I think it would be a step back to take the federal mandate or the federal program, at least the way it's been described so far. Who knows what it'll look like when they finally get done. But there is no need for a federal program. Minnesota has things that we need to do to make it better. And Minnesota Care is a great example. This is a program that we have for lower income people in Minnesota. It's very reasonable in terms of the premium. But the problem is that the benefit is only $10,000. The cost to the state is about $5,000 per person, and for that you need a $10,000 maximum benefit. Now, we've introduced a bill, Representative Gottwald in the House, and I have a bill in the Senate, that would take that and put it into the private insurance market. And you get a $5 million policy at lower cost to the state, including prescriptions, eye care. The point is that if you use the private markets to do these things, you can get better solutions. You can get them at a better cost. We have to find ways to continue to do that, and we are working on it in Minnesota. I would just say, why would we go down the path of having the federal government do this? Where's the example of the federal government being a low-cost provider of anything, or the most efficient provider? I don't see it. So I think that the argument is very simple. We've taken some steps in Minnesota. We've made some progress. We've got a lot of ways to go. But there are great ideas, and many of them have been introduced. We need to keep working at that. Get it right in Minnesota. We need to show the rest of the country how to do this.
Bill, you're running neck and neck with Emmer in the passion contest tonight, although the Brooklyn accent does get style points. Anyway, seriously, how do you sell this free market idea when there's federal money sitting there to be taken?
On this whole thing with the health care issue, I have to say right up front, I can't see a constitutional amendment assuring and guaranteeing that we still buy into the kind of private health situation that we have now. There's substantive things we have to do to change what is underneath all of that. Number one, we've got 55 mandates that have to be covered in the policy, written in to cover that exposed risk. Like lifestyle choices, alcoholism, substance abuse, you know, and you go down the thing, cleft palate, psychiatric nurses, psychotic drugs, all the rest. If you don't have those kinds of needs, maybe you don't have to have that written into your policy and the actuarial calculation figured out for your premium. Maybe you'll wind up, instead of with a premium you may be paying now, with paying $80 a month, because you don't have these other lifestyles. And build it to your lifestyle, make it also to where you can buy that insurance, not just in Minnesota, you can buy it in another state. Have tort reform so that you cap these, I can't find a word in English language that describes how despicable these fees that these attorneys are getting.
Hey! A necessary follow-up on that, Phil.
Uh-oh, here it comes.
No, it just, it's something that I thought of as you were talking and now has completely left me. So, we'll just go on to Mark.
I think we have to articulate the reason that this is bad for Minnesota. It will lead to rationing. It will hurt the Mayo Clinic. We already have the best, most available coverage in the United States. We're tied with Vermont for the most people covered by health care. So, A is we don't need it. Number two, I think we need to go a step further. And the bill that was authored by Senator Baucus yesterday is the subsidized co-op model, which will lead to the public option, which will lead to single payer. Socialism, by any other name, is just the same. And the Republicans had better stick together and vote no on that. Finally, we need our own solutions. We can't just say no to everything. We need private sector bidding. We need aggressive medical malpractice reform, including capping of punitive damages, capping how much trial lawyers get out of these ridiculous suits that Phil was just talking about. Number three, choice in insurance. If you can buy your car insurance from a Lizard in Maryland, you should be able to buy your health insurance anywhere in the U.S. that you choose. We need to end the abuse of emergency room use because it is 70% more expensive to use the emergency room than clinic or urgent care. And finally, and these are bills I've offered, we need aggressive welfare reform. We have 10 to 20,000 people per year, every year, moving to the state of Minnesota from other places and enrolling in one or more of our 4 largest welfare programs. That is clogging the hospitals, clogging the emergency rooms, and making everything more expensive.